Hey folks, Happy New Year. It's Dr. John here. It's been a busy end of the year for me, and I'm glad that I'm able to get back and do this video for you. But I'm going to do a little different video. We're not going to see any feet today. In fact, we're not really going to talk about anything related to feet or ankles in particular. But today I'd like to address the other side of medicine, the business side and the financial side. That involves health insurance. And again, for those folks who are watching me in other countries, I'm going to be discussing what I know, which is basically what health insurance is in the United States specifically. So at the beginning of the year, most people will have their health insurance restart. What does that mean? Normally when you call to make an appointment, the office will usually get your insurance information, and on your card, which you will provide for the provider, when you go to the doctor, it'll either say a copay or deductible or coinsurance, or, there's all these different terms that can be confusing for some people. And some people have the idea that, well, hey, I've got health insurance, I should be covered. Well, covered should be in quotations, because covered doesn't always mean the same thing for everyone. So what are the simple facts or aspects of health insurance? Well, one, you have your typical copay. What's a copay? Copay is essentially when you go to your doctor, you will pay a certain amount that typically is listed on your card, sometimes not. And there are some plans that don't have a copay, but a lot of plans have either a $50 copay, $25 copay, which is rare nowadays, $75 copay. And then also copays can differ between your primary care doctor or a specialist, or even going to the ER. So those can vary, and often your lowest copay is going to be with your primary care doctor. If you happen to go to a specialist like myself, a lot of times that copay is different, and sometimes it can be higher for that plan. What are the other aspects that a lot of people don't realize? Just like your car insurance has a deductible, insurance for your health has a deductible. So if your deductible, say, is $1,000 or $2,500 or $5,000, what that means is that any service that is covered by the insurance, that cost it goes to you until you meet that deductible. Let's say, give you an example. If you go and see me and you have a $25 copay and you pay the copay and you're diagnosed with, good old heel spurs or plantar fasciitis, and you receive an injection, well, that injection may go to a deductible. And if your deductible is, say, $1,000, and let's just put out a number, I'll say that the injection cost $100. Well, you've got to pay that $100 for that injection until your deductible is met. A lot of times it depends upon the service. There are certain services that are not subject to your deductible. Then there are certain services that are subject to your deductible. Well, how do we know all this? How can you figure this out? I will be the first to tell you it is very difficult to understand unless you are actually getting the benefits beforehand. So what my office does is that we'll get the insurance information. We will call and ask specific questions of what is covered, what services that we typically provide, and how they are covered, and is it subject to deductible, or is it subject to a copay, or is it even covered? There are certain services that may not be covered at all. And again, this is where it depends whether you have one insurance company versus another insurance plan. The major insurance companies are essentially Blue Cross Blue Shield, United Healthcare, Cigna, Aetna. These are probably the top for. Now, of course, you also have Medicare. Medicare is the insurance for our seniors, and that is through the government. So after a certain age, you can qualify to get Medicare, and Medicare will cover 80% of any covered service or any services that you receive. What does that mean? Well, the 20% that they don't cover is either your responsibility as a Medicare recipient, or you have a secondary insurance which will cover that 20%. So, but back to, like, say, seeing a specialist like myself, deductibles have to be met before your insurance will cover a certain amount. So let's say that you have met your $2,000 deductible. Well, then your plan may or may not cover the rest of it. So if you have a $1,000 deductible with 100% coverage afterwards, well, then guess what? A lot of times you may not have to pay anything except a copay. If you have a 80/20 plan afterwards, let's say you met your deductible, now the insurance company will pay 80%. Well, what does that mean? Then you are responsible for the 20%. Now, what does that mean, responsible for? Like, how much am I responsible for? This is probably one of the most conceptions about what is charged and what is allowable. So the way that you receive a charge for a service, and I'm going to give you an example because this is sometimes very difficult for some people to understand. If a patient saw me for heel pain, I see them for their very first time, there is a evaluation and management charge, which is essentially what we would call an office visit charge. Let's say I take x-rays. Well, then there is another charge for x-rays, which is separate. And let's say that I give them an injection of a steroid, a corticosteroid injection to help with their heel pain. That procedure is considered a surgical procedure and is separate from the evaluation and management, separate from the x-ray. So that has another charge. Now, what are these charges? How does the insurance company know what we did? Well, there are codes, or what we call CPT codes. And so these are common procedural terminology codes which are set universally for every medical specialty. And it is essentially a code that tells the insurance company what we did. So for an evaluation and management for a moderate problem where it took a lot of moderate time to figure it out and evaluate and do the exam and so forth, there is a certain code. For an x-ray, if I do an x-ray of the foot or the ankle, there are specific codes for that. And also when I do that heel injection, the steroid injection, there is a specific code for that as well. So one caveat, when you do see a specialist, especially like myself, a podiatrist or foot ankle surgeon, when you receive an injection, those procedures are, according to the insurance company and the terminology, considered surgical procedures. So sometimes you'll find out from your insurance company that, oh, my doctor charged surgery, and it was charged, $300, bucks for this surgery. He never did surgery on me. I just got an injection. Well, an injection, according to the insurance company and terminology, is a surgical procedure. So that is why it is listed as surgery. But again, that is not what our layman mind thinks of surgery, but that is the way that insurance works. So when you have a procedure done, whether it's an ingrown toenail removal or an injection or a wart frozen off, those are surgical procedures. And sometimes surgical procedures can be subject to deductibles. Sometimes is not. It depends upon each plan. So when you go to the doctor and you're thinking, oh, I just have a copay, well, it's not as simple as that. And that's why if you go to a good office that can treat you, they will give you some of this information up front. And that's the other thing. You can always ask. There is no shame in asking, doctor, is there an additional charge for this service? Doctor, is there an alternative, treatment that is less expensive? Or sometimes, we, do extra things just to make sure and be as thorough as possible. But sometimes it may not be absolutely necessary. And that can also reduce your cost of healthcare. So these are all, again, don't be ashamed to just ask. But try to be, cognizant also of your own plan. So since, probably the last 10 years, unfortunately, insurance has gotten, in my opinion, a little bit more expensive with premiums going higher and now plans becoming more just pure deductible plans or high deductible plans. For instance, if you have insurance and your plan has no copay, but it has a $5,000 deductible, well, guess what? Everything that you have done at the doctor's office, when it's a covered service, everything up to $5,000 is the patient's responsibility. It's your responsibility. And this goes for my own self. I speak as if I'm on one side or the other. I have my own insurance, and I have to go to the doctor as well for checkups and so forth. And so I feel the same amount. And we, as physicians, especially individual practitioners or solo practitioners, we don't get any discounts, believe it or not, on insurance. So I will just give you, for example, I will be upfront. My deductible for my plan is $3,500. For my visits to the doctor, regular primary care doctor, it's a $40 copay. But when I go see a specialist, my copay runs up to $125. So again, these are aspects of your insurance that you should be aware of, inquire about, but often, 9 times out of 10, you have to rely on the doctor's office to make sure that they provide you with adequate information on any service. Because the last thing you want to do is to get something done and you're totally blindsided by the cost. So definitely ask when you are at a doctor's office. So these are just small aspects. Again, there are so many different plans, so many different options for, care. And we just want to make sure that, we're aware of when you're going to see a doctor or a specialist like myself, that there's copays, there's a deductible, and certain things may or may not be covered. So for instance, in my office, we always ask, hey, are custom molded orthotics a covered service? And some plans will be, yes, they are covered depending on the diagnosis, which any insurance will tell you that, because we just can't give out custom orthotics to anybody who wants it. But then there are certain plans that say, well, no, covered, a covered custom molded orthotic is only available for diabetic patients. So that is a stipulation. So if a patient is not diabetic, yet their plan covers custom orthotics for diabetics, well, unfortunately, they can't get orthotics covered by their insurance. So that brings me to the other thing. There are certain items that just are not covered by insurance, and they can be an out-of-pocket expense. Well, that out-of-pocket expense sometimes can be lower than what insurance may allow. So again, the cost of what is allowed and what is billed is another aspect that a lot of people don't understand. So if I do an injection, and let's say, I'm just throwing out numbers, let's say the charge for that injection is $300. So a lot of patients, oh my goodness, my doctor charged me $300 for this injection. Well, this is the one thing that a lot of doctors' offices won't tell you, that when you bill out to an insurance company, you have to have the same charge for, whether it's Blue Cross Blue Shield or United Healthcare or Aetna. You can't have multiple different prices, whether it's Medicare even. So what most charges for, a service, say an injection, they're going to be about at least 2 to 3 times more than what they expect to receive. And the fact remains is that it's because of one insurance may allow more than another insurance company. So, for instance, example, I give an injection, and let's say it goes toward a deductible. If that injection with insurance company A would allow $150 for that injection, if I bill out $300, well, that insurance company will pay the full $150 for that injection. But let's say that insurance company B, they only allow $100. Well, again, if the charge is $300, then the $100 is reimbursed for that, and that allowable amount by insurance company B. But let's just throw out, let's say a company C has a reimbursement of $200. Well, if the charge for the injection was only $150 and the allowable amount was $200, guess what the amount is reimbursed to the service for the service? $150. So if you bill out less than what the insurance company pays, well, then they will pay you that amount. So that's why whenever you see a bill, a charge, it's always a lot higher. So never look at how much is charged. Always look at what is allowable. Well, what do we mean look, Dr. John? You should receive from your insurance company what we call an EOB, or explanation of benefits. This is sometimes, on your phone, you can look it up, or you sometimes will receive it in the mail, and this is after a service is provided. And so what that will show is, let's say you saw me in my office, and again, first time we did an x-ray, we did an injection. It'll show on the EOB, office visit or evaluation and management charge of X amount, x-ray charge X amount, injection charge X amount. But let's say that it will say this is how much it was charged, and then right next to it it'll say allowable amount. Well, allowable amount is what the insurance company says this is how much is really supposed to be the cost of this service. And so that allowable amount is what is applied to a deductible or to any out-of-pocket costs that you have, or a percentage. So just remember, look at your EOB, or explanation of benefit. If you haven't received one, call your insurance company and find out how you can receive that. So the main, aspect of this, I know I've been kind of rambling on here. There's so many different aspects of insurance that it can be confusing. Bottom line is this: make sure that you ask about the costs. The other one thing that I didn't quite mention on is in-network and out-of-network. Most of the time when you see a doctor, they're going to be in-network, and the cost will be much lower when you have as far as like what's allowable for in-network. if you happen to see a doctor or have like a surgery at an out-of-network facility or for whatever reason, if you have out-of-network benefits, then that service can be performed and be applied. Now, sometimes the cost on the EOB may be higher. The allowable amount should be higher. But the one caveat that is not told to most patients is this. Since that provider or that doctor or that facility is out of network, they're not bound by a contract with the insurance company. So everything that is charged or allowable, so to speak, or that is required is still negotiable. And so that's something that, if for whatever reason you got a bill for $500 and they're out of network, there's no harm in just saying, look, I can't afford this $500. Is there a lesser charge that you can give me? And sometimes out-of-network providers are definitely able to negotiate that balanced amount that is, allowed. Is so like, let's say they charge $500, and then the allowable amount is $500. Well, since they're not a in-network provider, that sometimes can be negotiable. So always negotiate. You can always negotiate. If it's an in-network provider, there's no negotiation because they are bound by the contract that they have with the insurance company to collect your copay, to collect your deductible. Same thing with Medicare. Medicare, we have to be able to, because it's a government plan, collection of 20%, collection of any co-insurance and any deductible in the beginning of the year for Medicare is required. In very, very rare instances where we have to document that a patient just is not able to meet their financial obligations, can we justify writing off an amount? But it's not as simple as just saying, oh, don't worry about it. We'll just accept whatever insurance pays. It's not as simple as that. So, but always inquire. Don't be ashamed to inquire about the cost. And honestly, if a facility or a doctor just won't give you the costs or the amount that you may or may not be responsible for, well, it might be good to find another provider then, because there's no reason, especially nowadays, that a facility or a provider, doctor's office can't give you at least an estimate. And I say estimate because even insurance companies, when they give us information, sometimes can erroneously give us information. So sometimes, and this has happened in my office, where we call the insurance company and they'll tell us, oh, $25 copay, 100% covered. And then when we bill it out, the insurance company applied a procedure or a device like a walking boot to a deductible. And when we call back, they say, oh, well, no, that's not correct. They do have a deductible for any procedures or medical devices that you give them. Well, they didn't let us know that when we first called, so that can be very frustrating. So, but in general, most of the time, if we inquire about it, and especially being in this business for such a long time, if it doesn't sound right, we'll call again and we'll talk to somebody else and get a second verification of that benefit. Because after being in the business 20 plus years, when it sounds right and when it doesn't sound right. So I'm hoping this is informational for you. Again, totally different topic. There's not many doctors that talk about this part of the aisle of medicine and healthcare. I'm trying to be as transparent and honest as possible about certain things. Of course, always, ask your insurance company and directly ask your provider that you're actually seeing. And again, this is mainly for healthcare in the United States. I know it's totally different in other countries, But from my experience and being in this field for this much time, I'm able to at least tell you what to expect. And so hopefully this was helpful. I hope that 2025 is a great year for you. And again, look out for some more videos on other medical aspects of the foot and ankle. So hopefully this is beneficial. If it was, please hit the like button, hit the subscribe button, and share. And have a great day. We'll see you next time.